Hi.
Hello.
I'm Brianna, the student pharmacist at D'Youville. I'll be taking care of you today. How can I help you?
I'm here to pick up a prescription.
Are you picking up for yourself?
I am.
Okay, and what's your first and last name?
Donna Matthews,
Okay, and just to confirm, what's your date of birth?
313.
Okay. And it looks like on here we have an allergy for NSAIDs. Are there any other known allergies up to date that you know of?
Nope, I just have the NSAID allergy.
Okay, perfect. So I see that this is a new medication for you. Do you have a few minutes just to sit down and talk about it, just so I can make sure you get the best benefit from it?
Yeah, that's fine.
Okay. So the purpose of this counseling session is just to make sure that I warn you about any precautions and just what to expect from the drug and just the normal regimen for it. So it looks like your doctor sent over a prescription for the brand name of Lexapro,
Okay.
but we filled it with the generic of escitalopram. So what did your doctor tell you that you'd be taking this for?
He prescribed it for my depression because I've just been really stressed out about some things. I have a tough school schedule this semester and I'm a little homesick.
Okay. I know myself. I've definitely been through that. It definitely is a hard time and it's super stressful, which is totally understandable. Some things that I did when I was going through it, exercise was a really good thing for stress relief. Also, yoga, meditation was one of my favorite things to do. Really helped. And also just talking to anyone. If you need to go to someone, just do whatever you have to do. And how did the doctor tell you to take this?
I can't really remember how he said I should be taking it.
Okay. It's one tablet a day. It's 10 milligrams. You can take it at the same time of the day. You don't need to take it, doesn't matter with or without food. If it seems to upset your stomach, then you can take it with food. What did your doctor tell you to expect from this? Did he give you anything?
No, he didn't really go over the side effects.
Okay, just some common things are drowsiness, maybe some nausea. There's also the chance for menstrual changes, so things like spotting or irregular bleeding throughout your monthly cycle.
Okay.
And are you pregnant by any chance?
I am not.
Okay, if you do plan to get pregnant, you absolutely need to tell your doctor first because this drug has been known to have some interactions with pregnancy.
Okay.
Also, I would definitely take this first to see how it affects you and then drive. See how it affects you first because sometimes the drowsiness, you might not be able to drive. Other things to precaution you about are definitely seizures, throwing up. Like I said, they're very, very rare.
Okay.
But just to warn you, if you do get a rash or any allergic reaction, definitely talk to your doctor about that.
Okay.
And lastly, if your symptoms of the depression don't get any worse, suicide thoughts don't get any better, definitely tell your doctor and then we can figure something out to better the effect for you.
Okay.
If you do miss a dose, what you can do is you can take it as soon as you think about it. And then afterwards, if it's too close to the next dose, just go ahead and skip it because we don't want you taking two at the same time. There's no refills for this.
Okay.
So when you are done with your 1 month supply, you can give your doctor a call or you can give us, the pharmacy a call, and then we can refill it for you. Storage, you want to store it in a cool, dry place. So nowhere like the bathroom. The moisture may have an effect on the drug. So and keep it out of reach. I don't know who you live with, but if young children or anything, keep it out of reach of them. If you decide to go on any other medications or herb or supplements, definitely tell your doctor about that too.
Okay.
And just to make sure you didn't miss anything, just go over the main points that I said for me.
Okay, so the doctor prescribed Lexapro,
Mhm.
which is the brand. You guys are giving me escitalopram.
Yep.
I'm going to take it once a day at the same time each day.
Mhm.
And if I miss a dose, take it as soon as I remember,
Yep.
unless it's coming up to my next dose. So then I would just skip that one. And store it in a cool, dry place. Don't store it in the bathroom. Watch out for any side effects like drowsiness. See how the medication affects me before I drive.
Yep.
I think that was it.
You pretty much hit everything. Yeah, definitely just want to emphasize on the seeing how it affects you first before you drive or
Okay.
do anything else. Also, you're going to take it once a day, like I said, with or without food. Doesn't really matter. You can see what you prefer. Nausea, maybe some other common side effects. If you miss a dose, like you said, take it when you think about it, but we don't want you doubling up. Also, no refill, so just give us a call so that we can have it ready for you when it's your next round. So, also, do you have any questions for me today?
I do not.
Okay, if you do happen to have some questions after you leave, you can come back to the pharmacy or you can give us a call. I'll be here. Any pharmacist here would be happy to help you.
Okay, thank you very much.
Thank you so much.
Have a nice day.
You too.